Hello, welcome to Sonography Radiology Training channel. This series of videos is about amniotic fluid imaging. This is the first video in this video series with title of Idiopathic Polyhydramnios. The outline of this presentation include introduction, incidence, mechanism, amniotic fluid volume measurement, pregnancy outcome in idiopathic polyhydramnios, recommendations, and final teaching points. At first, introduction. Polyhydramnios is defined as an excess of amniotic fluid surrounding the fetus. Polyhydramnios that is not associated with congenital anomalies of central nervous system or gastrointestinal tract, maternal diabetes, autoimmunization, fetal infection, placental tumor, or multiple gestation is termed idiopathic. A thorough investigation of the mother and the fetus is mandatory to rule out all these conditions in order to refer to a case of polyhydramnios as idiopathic polyhydramnios. Incidence. Idiopathic polyhydramnios accounts for approximately 15 to 60% of all cases. Mechanism. The mechanism by which idiopathic polyhydramnios develops is not known, but some proposed theories include: these studies show that maternal bound water channels called aquaporins may play a role in the development of polyhydramnios, but the exact physiology is not yet understood. Another theory is maternal hypercalcemia. This study suggests that the fetuses exposed to a hypercalcemic environment may have a polyuria develop similar to adult hypercalcemic polyuria, leading to fetal polyhydramnios. Maternal serum calcium levels may be part of the investigation in otherwise unexplained polyhydramnios, as maternal hypercalcemia may threaten the health of both mother and fetus. Another theory is substance abuse and polyhydramnios. Some studies show that maternal substance abuse is associated with a significantly higher incidence of polyhydramnios and should be considered a possible etiologic factor in women with apparent idiopathic polyhydramnios. Amniotic fluid volume measurement. Amniotic fluid volume can be measured directly at cesarean delivery or using dye dilution techniques. However, these methods require laboratory support and in the case of cesarean section can only be performed at the time of delivery. Because of this limitation, amniotic fluid volume is estimated routinely using ultrasound. The most widely used techniques to estimate amniotic fluid volume are amniotic fluid index and single deepest pocket, and also subjective assessment or visualization of fluid volume without measurement. Polyhydramnios is defined generally as amniotic fluid volume index equals or more than 24 cm or single deepest pocket equals or more than 8 cm. Also, there is some variation in these definitions. Polyhydramnios is categorized as mild, means amniotic fluid index between 24 to about 30 cm, moderate with index between 30 to 35 cm, and severe means amniotic fluid index equals or more than 35 cm. Pregnancy outcome in idiopathic polyhydramnios. The relationship between the idiopathic polyhydramnios and prenatal outcome remains unclear. Obstetrical complications record more often in pregnancy complicated with idiopathic polyhydramnios than in normal pregnancy include preterm labor, increased rate of cesarean delivery, premature rupture of membrane, malpresentations, abruption placenta, and postpartum hemorrhage. You can find full explanation about placental abruption in this video. Recommendation in idiopathic polyhydramnios. In their consult series, the Society for Maternal Fetal Medicine suggested that antenatal fetal surveillance is not required for mild polyhydramnios, and that delivery should be allowed to occur spontaneously at term. Other investigators advise performing antenatal testing such as the non-stress test or biophysical profile when polyhydramnios diagnosed after 32 weeks gestation. because idiopathic polyhydramnios is associated with a 2 to 5-fold increase in prenatal mortality. As long as antenatal evaluation remains reassuring, they recommend delivery at 39 weeks. Now, please pay attention to these final teaching points. Although maximum cases of idiopathic polyhydramnios have mild polyhydramnios and are detected in later gestations, there is a high incidence of obstetrical complications and poor neonatal outcome associated with it compared with normal pregnancies. Thus, idiopathic polyhydramnios is an independent risk factor for perinatal morbidity and mortality. Also, congenital anomalies missed on level 2 scans can present as idiopathic polyhydramnios, which are then detected postnatally. So, it can be advised that idiopathic polyhydramnios be considered a high-risk pregnancy and managed in tertiary care settings with a detailed antepartum fetal well-being surveillance, intensive intrapartum fetal monitoring, and postpartum attention by an expert neonatologist. Now, I suggest 2 others of my videos that are close to this video in terms of matter. And thank you for your attention.